gonna teach you how can use that pillar 1, 2, 3 plus panels to increase your patient's low back condition. First of all, I'm gonna explain about the pelvic function. So basically, we have two curves on the body, and one is at the cervical lordotic curve and lumbar lordotic curve and pelvic area. So head in here, and then we have two lordotic curve on the body. But I'm gonna teach you that the low part, how can you make that the better function of your patient's low back. But basically, you have to understand that the pelvic function first. Okay, this is the spine bone, cervical, thoracic, and lumbar, and the pelvic area. You should understand the pelvic tilt concept. First of all, when do that the pelvic tilt to anterior, and lordotic curve gonna be increased. That means that the facet joint gonna be decreased, and the intervertebral foramen gonna be decreased. So anterior pelvic tilting increase lordotic curve, and then jammed sometimes facet joint or decrease intervertebral foramen. But posterior pelvic tilting, that's make that the increased facet joint, and other one is intervertebral foramen. So two different concepts you should understand it. Why? Because when you do that adjustment, you increase the facet movement too. So depend on your patient condition, you have to control that the lordotic curve to use that the pillar 1 to 3 plus panels. When your patient lay on the table, basically you can see that the lordotic curve like that and the pelvic area. Depend on the pelvic posture, like posterior pelvic tilting, the lordotic curve gonna be decreased, and then when they do that their anterior pelvic tilting, the lordotic curve gonna be increased. The same concept when they stand up. So when you use the panels, you have to figure out what kind of motion gonna be better for your patient. If your patient has like impingement or pinched nerve on the lumbar area, you might be increase the intervertebral foramen space and increase at the facet joint. So that's why that they use that the panels under the pelvic area and do that exercise like that posture, because intervertebral foramen gonna be bigger and that joint space gonna be bigger. That's why they're gonna have that the less pain on the low back, and you can promote any kind of exercise, whatever they need. Later movement might be used that on the back area. That's that increase at the lordotic curve, and they do the same exercise again. But first of all, acute condition, use that on the hip area and then bring it down and do that the exercise or whatever you need. That's basically we use the panel. We control the height of panels that decrease at the lordotic curve or increase on the lordotic curve. So basically I'm going to show that the whole story about the patient care. First of all, that if your patient has acute pain on the low back, I start that the adjustment or joint mobilization, increase that the facet joint function first. As soon as I finish that the joint mobilization or adjustment, I educate the muscle. So alignment first. So for example, I do that the 3 or 2 panels first on the pelvic area, put down there, and bend the knee, and ask to my patient, how do you feel? And then maybe he not gonna have pain that much at the part. Then I remove that one panel again, and down. And then ask again that how is the low back pain is going. So if he's fine, then I move this panel to upper part and put it down and increase at the lordotic curve. And ask the patients, how do you feel again? So if he feel fine, then I add one more panels on the low back area and put it down and make that the pelvic anterior tilt and increase at the lordotic curve. So if he's fine, then I started at the lumbar stabilization exercise at this part first. I make that isometric contraction first. Okay, hold against my force and contract that abdominal oblique muscle first, and do the other one. Okay, basically that the lumbar stabilization exercise have to start from the spine and then go outside. That's the basic concept. Of course, you have to do stretch under like hamstring, piriformis, or iliotibial band, or QL, sometimes iliopsoas muscles. That's the basic muscles you have to do have better flexibility when you start that lumbar stability exercise. But at these times, your patient is too much pain, then we have to build the muscle strength because function-wise, we have to increase first and then do that the later other function added. So after this one, you're gonna educate your patient, press down the panels as much as you can, press down, and relax. Most of isometric contraction, I say to my patient to the same posture about 10 seconds. So more than 7 seconds it works. So that's why that I use that the 10 seconds is obviously work the isometric contraction on the core muscles or lumbar area. Later going on, when he feel better, I'm doing the concentric contraction exercise. For example, rocking is at the move all the way from there to move to the other side. Push my hand, go move it, and go move it, go move it, go move it. Maintaining lordotic curve is very important because minimize muscle contraction on the routine daily activity. So that's why that I try to maintain lordotic curve, do the stabilization exercise, hold the relaxed technique, or the concentric contraction. Okay. You saw that the previous exercise, but actually you have to figure out how to happen on the spine. First of all, we put the 2 panels on his pelvic area. So that's why that his body weight going through like that, decrease at the lordotic curve, but they increase at the facet joint and intervertebral foramen. So that's why that if your patient has pinched the nerve or ligament or something, you're not gonna have that much pain. But the final point is that we have to do increase lordotic curve. Why? Because that's why that minimize that muscle contraction on the routine daily activity. So that's why we have to promote that the lordotic curve is better. So first, that one is that we use the pelvic and increase the foramen, but his lordotic curve is decreased. So that's why that later going on, we move to the lumbar area and increase the lordotic curve and do the activity and educate the muscles and how can properly do that muscle activity. Your patient have like a really good function, but I'm gonna show that the several exercises how can use that the panels for your patient case. My patient case, if my patient has almost normal, and I have to build up the muscle strength. Most of the times I focus on the low part of the muscle that increase the stability on the lumbar area and a lot of functions they can do when they have strong the core muscles. So what I'm doing that I put down that the panels under his hip area first and down and extend the full legs and go up all the way. And I educate to my patients, you're gonna raise your foot to ceiling. So 1 up and down. Okay, 2 up and down. And 3 up and down. Okay, bend it. This is the hardest exercise. Most of the times more effective they can do that they build up the lower part of the muscles. So that's why I educate that muscle function like that. Or I can do the full extend leg and hold that one and move to side and to the other side. And to the other side and to the other side. Okay, bend your knees. Okay, this one is that there is a simple way to build up without that increased lordotic curve. So you're in your patient doing this kind of motion, it's less painful on the back area. But if your patient has a better lordotic curve, I move the panel on the back area out there. And same exercise I'm gonna show you. Double leg up. And up. And down. You can see that when they're down, that the lordotic curve is down like this because the panel's gonna be supported at the lumbar lordotic curve. So go up and down. Same exercise, but each more motion you can promote it. It's fully extended the lower part of the muscle and the full up, go up, full flexion and down. Or the same part of exercise, leg extended and with the maintain loaded curve, and move side or the other side, and move other side and the other side, and bend your knees. Okay, so depend on your patient condition, you can use the panel on the pelvic area or lumbar loaded curve or decrease at the loaded curve. Depend on degeneration or their age, you can choose that exercise, but easy way is that when you support properly, they're gonna have less pain and you can build the muscle strength. And the paraspinal muscles, that's the factor you use that the pillar 1 to 3 panels. Now I'm gonna show you another exercise we call that curl up, but the loaded curve is gonna be maintained, and then you're gonna do curl up exercise to educate your patients. First, the legs up, and same times your elbow gonna be touch to the knees. Okay, and bring it down all the way. So you have to concentrate on the loaded curve, because without anything and then not proper support, it's harder to maintain the curve. So do that again, go up and touch it. Okay, down. This is more abdominal muscles, but all the 4 layers, that abdominal muscle is contracted. Of course, rocking is how to build the abdominal oblique muscles, but at this one is the more central part of abdominal muscles built up. Okay, go up and down. Okay, you learned about how can you use pillar 1 to 3 plus panels to increase your patient's low back condition. But do not forget about the flexibility of low extremities. If your patient do not have that enough flexibility on the low extremities, might be they're gonna have that low back problem again, or that's hard to stabilize on the low back part. And second one is that you have to remember that you have to build the paraspinal muscle, and then after that one you go to around the muscle. So third one, you have to remember about that maintain loaded curve, because they're gonna do a lot of routine activity, and when they have that better curve, then minimize the muscle tension, contraction, or activity. So that's why their muscle gonna be less tense at the night time or any other time. So that 3 things you have to remember all the times when you take care of your patients. And a lot of things you can do with the panels, even the thoracic or cervical areas. So don't forget that you can use this kind of a pillar 1 to 3 plus for neck care, thoracic care, or lumbar care. Okay, thank you.